Hi, friends. Dr. Nancy Trimbley here, putting the power and knowledge of your health back in your hands. Today is April 16th, 2021. The Johnson & Johnson reformat, as I call it, was pulled from the market 3 days ago. And I have to tell you, friends, I was wrong. I was wrong because I thought it would take 2 to 5 years for problems to show up. And no, it took 2 months. Are you listening out there? I And the problems that have occurred with the people who have died or who are gravely ill are exactly what I said would happen. The reformat tells your body to make something that looks like the COVID-19 virus shell. And I said, what happens if that shell appears similar to another normal something in your body? So your immune system attacks the foreign shell, but then it also attacks a normal cell. And in this case, it is the platelets. It is those things in your blood that help our blood to clot. And in a rare type of cascade of events, it causes these people to get blood clots. Now, in the initial reports, it said that there was 6 women between the ages of, I believe it was 18 and 48 years old. And the problems occurred 6 to 13 days after they received the Johnson & Johnson reformat. As you may not know, only approximately 1% of any vaccine adverse reaction is reported. I know this from being a member of the National Vaccine Information Center, which you can check out their site, NVIC. I knew it was just the tip of the iceberg then. I believe that there's probably many more cases that are being misdiagnosed or plain old missed. Or in the case of somebody I know who told me today, her husband's been in the hospital for 4 days. He received the Johnson & Johnson shot on Friday last week. It was pulled from the market, I think she said Sunday. By Tuesday, he was in the ER, and he's been in the hospital for 4 days now. He does not fit the demographic of a female 18 to 48 years old. I think there's going to be a lot more of these. So if you are out there and you have been on the fence or you've made a decision, I applaud you for your strength, because I know a lot of you are being pressured to get the reformat and you don't feel like it's right. You don't feel like it's been tested enough. You want to wait to see what happens. And I applaud you for waiting. It's only you that can make that decision about your own health. As you know, I invite you to take back the power and knowledge of your own health so you may get your greatest joy out of life. So here's the next questions we have to ask. Okay, so supposedly it's a very rare reaction. Supposedly it only occurs in the first 2 weeks. Well, do we know that? No, we do not know that yet. What is the treatment? Okay, if you think about it, all right, our immune system is reacting to something that our body is making. How do we stop our body from making it? That's question number one. What is the treatment? Do we now dismantle our immune system for those people that are suffering from this rare disorder? What's their life going to look like when you start dismantling the immune system? Now, I remember when AIDS was first on the scene in the late 80s, and that was a dismantling of the immune system, of the T4 cells. The T4 cells are active in this messenger RNA reformat. So now we have to dismantle people's T4 cells so they don't get blood clots. And now what happens? Do they appear like an AIDS patient? I don't know. I'm just thinking. We don't know. So how long does treatment last? How long do the effects in the body last? Does it stop with the platelets? Other questions might be, if the vaccine only maybe lasts for 3 months, does it stop after 3 months? What if you have to get another vaccine in the future because it only lasts 3 months? Are people going to sign up for that? We don't know. And that's been my whole point this whole time. We've not had the time to test it. And yes, it is really, it's really profound science. This is cutting edge science. We are manipulating our body to do something it has not done before. But is it such a good idea? And is it really necessary? So, on a future video, I'm going to talk about cases now in early 2021 and how that's looking. So, stay tuned for that. That'll come out in the next couple of days. All things to think about. As always, I invite you to take back your power and your knowledge so you may get your greatest joy out of life. Bye for now.